So I'm the HR advisor at the Mental Health Foundation. I've been there for about 18 months. I look after recruitment and payroll and our Cezanne. So lots of helping with writing job descriptions, working with our line managers in terms of their recruitment needs, putting plans in place for those, supporting them with interviews, setting up invitations for interviews and that kind of thing. I oversee our payroll, so it'll be a lot of working to deadlines in terms of submitting our payroll information to our payroll provider. And then I work with our line managers really on advising them in terms of implementing policies. I do policy reviews, any advice really that our employees need. So every day is very different and I will get a multitude of all sorts of inquiries coming in on any given day really. Within the charity sector, there's quite a lot of fluctuation in terms of funding, which then has an impact on our staffing. So we might have quite a bit of churn and or if a project is coming up and getting put into place within a short time frame, we're then looking at recruiting quite quickly, that type of thing. So when I joined the foundation 18 months ago, we didn't have an HR system at all. So I joined and said, what system do we use? And they said, we don't have one. So we spent the best part of my sort of first year really looking for a system which was going to do all the basic stuff that we needed, act as a database, do all the absence related things, and aside from the basics, be something that we could then build on and really use. We're a small HR team for 140 odd employees, so we need the system to do a lot of the work for us. It's helped hugely. Aside from anything else, it's having all our staff details in the one place and enabling. We had staff using all sorts of different ways of recording their annual leave or their sickness, or we'd find that people just weren't recording it at all, so people had no idea how much holiday they had left, how much they'd taken, all sorts of things, and we had no way of monitoring or reporting on it at all. So those modules have helped hugely. Being somewhere that we can actually direct people to say, this is how you're going to find out how much holiday you've got, or this is where you need to be recording your sickness absences, so that we can actually look at that, monitor it, report on it, do something about it when issues arise. It's made a huge difference. People are quite excited to be able to use it and to, again, it's having things in one place, isn't it? And being able to get to that information easily. It's about, I think, consistency will help, again, because we've got so many managers and staff using all sorts of different ways of recording this type of thing. We don't know always where it is and who's got what and who's reporting on what. So actually bringing all of those things into a consistent format is going to be good. It's certainly enabled me to pick up where people have had more sickness absences than we might hope for. And it's enabled me to actually check in with line managers a lot more frequently to say, I think there might be an issue here, what can we do about it? And it's about nipping those kind of issues in the bud. So it's helping a lot already on that. They really like it. A lot of the comments have been how user-friendly it is. And again, just for line managers to be able to see all of their staff in the one place, to have a look at the calendars and see who's off when and all those sorts of things. They're, on the whole, really pleased with it. It's gone down pretty well.